Hello, everyone, and welcome to this episode of Road to Wellbeing. I am Zykia McCurdy, your host, and I'm joined by Chris Baker. So, today we'll be talking a little bit about wellness and finance. So, what if the budget meeting could be the easiest conversation of your year instead of the hardest? Both finance and wellness want the same thing: a healthier, more productive workforce that costs less to ensure. Today, with Christopher Baker, we get into how to build a case finance defense on your behalf, even when you're not in the room. With 20 years across wellness, population health, and carrier based solutions, Chris Baker helps employers move beyond standalone wellness programs. As a health and performance consultant at Hub International, he integrates workforce health into how a business actually runs by optimizing cost, productivity, and stability. Thank you so much for joining us today, Chris.
Happy to be here. I appreciate you inviting me.
Awesome sauce. So let's jump right into it. So, before we get into finance, what does poor workforce health actually cost an organization?
Oh gosh, I mean, we could get into the finances, of course, right? I mean, it can be depending on the organization, the industry, and so forth. It could be thousands, millions. It's can be a large amount of money.
Mhm.
I think just as important though are the intangible factors, right? So morale, and I look at this topic in terms of well-being as opposed to just wellness. Well-being being everything that incorporate is incorporated into the conversation, the workplace environment, all of these intangible types of things, as opposed to what we consider typically the five pillars, right, in wellness, which would be,
Mhm.
and depending on who you talk to, those pillars might be 10 pillars, might be three pillars,
Maybe
right?
eight,
Um,
maybe, yeah.
but I think what's really valuable in terms of reducing cost is that morale of your workforce, being able to recruit and retain people. That's a very expensive cost
Mhm.
that I think a lot of organizations they know about, but don't look at when they're looking about implementing a wellness or a well-being program.
I love that because you literally just touched on my next question. Is where does that cost show up? So you mentioned it's in that retention and how much it costs to kind of go out and look for those new employees. Um, and then I have another thing to kind of build on that. So how long before an employer that ignores this starts to kind of feel the impact of that like cost?
Yeah, that's a great question. So I think I have a couple of thoughts on this. So
Mhm.
I don't know if the impact is felt immediately, right? I think though over time, what ends up happening is you see the same conversations come up over and over again, right? So initially, there might not be a thought about being very strategic in terms of implementing a plan. It might be just kind of a fun. Let's have some massage or something like this, right?
Mhm.
But over time, as costs increase, and then turnover potentially increases, and then it's very competitive. There's a very competitive environment to hire employees. That type of thing can turn up. So I would say it's probably it could be a year, it could be 2 years, 3 years, whatever it might be. I think on the flip side, you'll probably ask about this a little bit later in terms of when's an ROI, when can you expect that? And I think there's a misnomer that as soon as you make changes or implement something, you're going to have an immediate impact, and it doesn't always happen. I think patience is key. So just as long as it takes sometimes to see these things festering and costs starting to rise, it also takes a little bit of time to reduce them, right? And be a little bit patient
Mhm.
on the back end. So yeah, this is a patience. This is a marathon type of industry for sure.
Yeah, and I love that you mentioned that with the it'll take a while to see kind of the cost, but it also takes a bit to see the benefits as well. And something that I've kind of noticed on my end too is when we're speaking with the clients, they're like, well, what's the ROI? What's the ROI? And they want to know as soon as possible. They want those results in year one.
Yeah.
And as you mentioned, it is like a marathon where it takes some time.
Yeah, and I understand that. I mean,
Hmm.
if particularly if there's going to be some type of investment made in programming, I mean,
Hmm.
organizations like to see the return, and I think being honest and saying, look, you can see a return, but you have to be a little bit patient, and you can educate and consult with organizations and people on that. Doesn't mean that
Hmm.
they're going to respond the way you want them to respond, and that's just human nature.
No, that's totally understandable. And that kind of guides me to my next question. So we're speaking a little bit about ROI and how people want to see whether the program is working or not. So what metrics do you believe genuinely indicate whether a program is working?
Well, I like to really focus on the productivity side of things, right? So,
Mm,
absenteeism, presenteeism, recruiting, and retention. I think if from the organization standpoint, again, I'm saying this not being the financial guy, right? So I do think that your labor force is really the biggest investment you have in an organization. And if you take care of those people, and it doesn't mean you coddle them, but you provide them the opportunities and avenues to improve themselves, not just within the workplace, but also outside of the workplace, I think it pays huge dividends. So I think if you start to see improvements in those areas, you'll start to see your financial return on investment. Although that's a little bit slower. Again, it's
yeah.
I'm always honest with clients, and I'm like, look, you'll see a return on investment, but those organizations that invest in the improvement of the culture, which
Hmm.
takes time and takes patience and a commitment, are the ones who will see that 3 to 6 to 1 return, right? I mean, we hear that number batted around quite a bit,
Yeah.
and then on the flip side of it, people like myself and maybe yourself, you'll hear from people, well, there's no return on wellness programming and so forth.
Yeah.
It's all. I mean, do I agree? Sure, I can agree with that to an extent, but I also think it's related to what you're putting into it. I think
Hmm.
that's very key. So I would say productivity. Are the people happy? Because then they're going to be doing their best for you.
Hmm. Yeah, I love that you mentioned paying attention to productivity as one of those productivity and retention as those markers or kind of those indicators that a program is working. You also mentioned that sometimes people are like, oh, well, wellness doesn't pay off. And I think sometimes that's because we're looking at like a vanity metric. So it's like, oh, are people eating better? Are people doing this? And when you are having that finance conversation, it's like, okay, cool, but we're investing a lot of money into this. How is this helping our bottom line? So I do think that's a really great point you bring up.
Yeah, I think you know, businesses they're in business to make a profit, right? Like,
Yeah.
you just we just don't up that. Like I get that, right? So anything
Hmm.
that we can do from the well-being perspective or any perspective to help a company be more profitable, that's what the financial people are looking for. And I understand
Hmm.
that they want to save money on healthcare costs. What's the best value and what's the best investment for their time? And so that makes perfect sense. So we can always come back to the dollars, and
Hmm.
that's always a great thing to look at. But there's a lot of stuff that goes into those changes, right? Like we were just saying, the
Yeah.
productivity, your workforce, those types of things, and making changes is not easy. So what
Hmm.
gets discussed oftentimes, and this is whether it's an individual or a corporation or a small
Hmm.
business, um, you know, it can make perfect sense. Like things that you discuss with companies can make perfect sense. Okay, let's implement this. Let's do this. Yeah, or if you're trying to change your behavior on an individual perspective, makes perfect sense, but it is difficult to do, right? Behavior
Yeah.
change, whether it's on the individual or the corporate side, can be
Hmm.
very difficult to do. And then you throw in all the other factors with a corporation, multiple
Yeah.
people, decision makers, and so forth. It can become very much of a challenge.
I love that. And thank you for kind of touching on that too, which once again, you are perfect because you keep guiding me to the next
Right,
question. So
yeah.
thank you. So now we're speaking a bit more about how to make the case for well-being programs to finance. So how do you start to build that business case around well-being?
Yeah, I would say most importantly, the more data that can be
Mhm.
gathered is vital, right? With anything, it's very difficult to make changes and improve things unless you have a baseline, right?
Mm,
So you can look at demographics, you can look at claims information, other analytics and information that can be gathered. And really, I don't think there's too much information you can have, right?
yeah.
So the more information you can have, the better you can create well orchestrated strategy. But I think one of the key points, one of the key things that gets left out of that, oftentimes when this discussion comes up, is how is this going to look in the total business strategy, right? So
Mm,
one of the things that I like to take a look at, if possible, is what is the purpose of the organization? What are they trying to accomplish? What's the business strategy? Because I think then when you tie that in with informatics, data, demographics, claims information, all of these types of things, you can start to put together something that meshes well with the business strategy because ultimately that can drive assist in driving those outcomes that people in the C-suite are looking for.
yeah, I love the idea of kind of bringing it all together. I do feel like sometimes well-being or wellness programs in a company are pretty siloed, and it's like, oh, well, we're just doing this to kind of check a box. But as you mentioned, when it's really integrated into the culture of the company itself, which, as we said, takes a little bit of time, then it does start to make more sense for kind of placing that emphasis on well-being programs too.
Yeah, that's tough. I would say, you know, I think companies can find a few bucks to
Hmm.
spend on something or be somewhat supportive. I think the real challenge is for the time capital that needs to be put in.
Hmm.
Most organizations that I've worked with don't have a dedicated wellness, health, and performance person on their staff. And really, for this type of thing to work, you really need somebody who's committed. And that doesn't mean it can't be done within HR and having a wellness champion network and so forth. But it's very challenging for these HR teams because they've got a lot of things to consider.
Hmm.
So as I talk with companies, sure, it's potentially looking at point solution options, looking at what they already have within a carrier resource. What are some strategies? What would they like to see? I always throw out a question to companies when I meet with them the first time in a discovery call. I'll say, if you were in an airport and you're talking with your friend, and you're talking about your program, your wellness program, what and somebody walked by, what would you like them to hear about that, right?
Ooh.
And it's interesting because a lot of organizations aren't quite sure what that is. Like they haven't thought about that. They simply say we need a mental health solution or whatnot, and so I think it takes time to put. You have to put some thought into this
Hmm.
to really make it come off. Um, and and it's not that organizations don't want to do it. There are time
Yeah.
constraints, right? So
Hmm.
I think taking some time, setting aside a little bit, and laying that out again. You and I have talked, and I know I've shared this with other people. It's just an analogy of you can't land a 747 on a short runway, right? And
Yeah.
it takes time. So these programs and these concepts and ideas that organizations would like to put in place take some time. But once they're in place, then it's a maintenance. It's maintenance
Yeah.
phase. And one thing you mentioned here about the silos, I think even within, you mentioned as wellness
Hmm.
being a silo. It's a kind of, it's always been looked at as a perk or it's a nice to have.
Hmm.
It
Hmm.
really isn't that anymore. It really has to be part of a strategy. But even within that framework, when you look at physical health and mental health and financial health and all those things, they're all in play, right?
Hmm.
To put those in silos is very tough because if any one of those things is off, you can look at spiritual health, whatever it is. If any one of those areas is off, it has an impact. So I think all of these
Mhm.
things need to be looked at collectively.
I love that idea too, because as you mentioned, when there are programs created, and this actually takes us to the next question, is sometimes it'll touch on like one dimension. So it's like, okay, we need to do something, let's put this mental health resource in place, or we need to do something, let's put this like gym pass thing in place, but never the whole holistic viewpoint of a person. Which I think, as you mentioned, it does take time to build up to that. So, for my next question, actually, if somebody's just getting started and, budget is a little tight and it's something that they're kind of concerned about, what would you say are some of the basic building blocks that a company can start to use to build a well-being program, without, the biggest budget?
Yeah, I think well, to start with, their medical carrier probably offers some type of education, some type of wellness resources. They're all a little bit different in terms of the extent to which they offer it, but most will offer some type of newsletter program, annual calendar, and so forth. And
Hmm.
and if they don't, you can find a variety of those in different areas online. And there's a lot of
Hmm.
organizations that offer annual calendars that you can set your programming to. But at the very basic level, so there's a lot of these organizations that I work with starting out that they don't have anything in place. So a couple of things I encourage them to do. One is to be persistent with what they're trying to do. And the reason is because if they don't get a lot of traction with what they're trying to do in the near term, their employees need to know that it's going to be there, right? That there's something they are working towards. And if it just becomes part of their vernacular. And they could brand the name. They could come up with ABC Wellness, whatever it might be, right? They can come up with the name. But if they brand it and they provide educational materials, so and those don't need to cost much. They can do a monthly newsletter. They can have an educational seminar. Those types of things, very basic,
Hmm.
just to get people thinking about these things and then building upon that. I think is key. Also, I think it's important to know what your employees want. So, offering a survey, and it doesn't have to be long, but just to get an idea of where they might want to go, what they might have an interest in starting with, because I do think you want to get a hook, right? You want people to enjoy what you're putting out, excuse me, and then you can always build out on some of those items that maybe will have that financial impact down the road.
Hmm.
So if you do have, if you have a little bit of money and you want to bring in a chair massage therapist and talk up your wellness program and provide education, it's a great way to get started. But of course, that's not going to be the end all. But you're doing it with the thought of, hey, we want our people to know their numbers, right? We want them to get their
Hmm.
screenings. We want them to become educated in that. So it can be very uh, very low budget.
Hmm.
But the key is persistence. Keep it going. If emails don't get open, if people aren't reading, whatever, keep it going because
Hmm.
these people in your organization really need to know that it's going to be there and it's not going to change every 5 minutes.
That's so interesting that you bring that up because that's something that I do tend to hear from a lot of our clients. So some of them who are just getting started out, they're like, look, we just want the very basic just to build it. And then something I've noticed is that if they're not seeing the results they want right away, then there can sometimes be, oh, I don't know if this is going to work. I don't know if we should continue with this. And I think that's interesting because, when you're coming into a well-being program, you're excited to bring this to your employees. You're excited to get this started. And then when interaction starts to dwindle down, you're right. That is when people are like, look, hey, I'm too busy. Why not? And as you mentioned, there typically isn't a dedicated well-being person on site. So that's when it goes to the wayside.
Yeah, I think that patience is key. So um, a great tool that from a marketing perspective, I think it's a really powerful marketing tool that every organization has is its own employees. So if
Mhm.
you're trying to get something started off the ground and you know that there's some people that even if you didn't have a wellness program, are still going to do certain things from a lifestyle perspective. They still exercise. They still watch what they eat. They're successful in this, and you recognize it. Um, you can always ask them to participate in a little testimonial or whatnot,
Hmm.
right? Because this is the other thing. HR people are always excited about being able to do something positive for their employees, right?
Yeah.
And oftentimes from the benefits perspective, they're responsible for making sure that people are putting this out where people will use those benefits and participate. Well,
Yeah.
it's far more effective if somebody in a cubicle next to you has had some success or done something and then shares that out with colleagues. Because
Hmm.
it's like, well, I'm not being told something because it's their job. I'm being shared with because this is a person I work with every day. And if they can do it, maybe I can do it. And it catches on. But again, this takes time. And I think often, again, going back to the behavior change thing, it is not it is not an immediate impact. So using your employees, asking them, hey, would you be willing to participate in could be a little recognition program, a little testimonial if you're trying
Hmm.
to get something off the ground, um, is a great way to do it. The other thing I would say is our mentality, and I say American mentality is all or none, right? It's kind
Yeah.
of we're either going to do it and we're gonna be all in and successful, or we're not. And I think it's important, particularly going back to individual or corporate behavior change, that you have to build on small successes. So, and it
Hmm.
takes time to get those successes. So, if you if on the company side, right, you're putting out educational materials, that's successful. That's a step in the right direction. You can't control how people will respond to it. You just have to keep putting it out there. And then if you start to see a pickup, or when you start to see a pickup of interest, that's a success. And then you build off of that. And that's the other way that you can start to bring some of these things forward to the C-suite for more investment.
And once again, you kind of brought it right back to where I was going to too, because you brought up so many great points. And I think earlier you mentioned how to build that business case for finance. You mentioned having that data and things to kind of show the impact or the progress or why it would be important. And then starting with these smaller steps, that's one of the things people can do to start gathering that data within their own organization. Like, hey, we have this many people signed up for the newsletter in that building, and you start to build your own like case study pretty much for the program at your own organization. So I love that. And I also love the idea of testimonials and social proof. Social proof is one of the strongest
Mhm.
things to push behavior change that I've seen. And I think that's something that a lot of companies don't consider at first. It's kind of just like, oh, we need to see it in like, we need to tell people it's this amazing. We're just going to tell them why it's so important, why they should do this, instead of having like Jane in next to me who's like, yeah, so I did this program and it worked. And yeah, I think that that's a lot stronger of a type of motivating factor, but also one that's most slept on in the industry, honestly.
Yeah, no, 100%. And I mean, I think you mentioned that, I like you were talking about Jane and, all this. I think what happens is instead of telling people that they should do this and it's good for them, and this is, and I'm speaking on the individual and corporate side.
Hmm.
Um, the way that this kind of stuff takes hold is for people, I'll just use that term, to understand their why. Why is that important to me? Right? Why is it important for me to make these changes, whether it's individually or corporately? Right? If I understand that why, it gives me something concrete. If I'm told that this is important, but I haven't really sorted out why that's important to me. It's just somebody has told me that, because here's the other thing you find: you put a little dog in a corner, they're going to fight back.
Yeah,
So even if people know that you're correct, they don't want to be told,
yeah,
right? They don't want to be told. They want to make their own decisions. So if you can help them in developing these programs to understand the why, and that goes back to the data, that goes back to the business strategy and building that business case for your financial and C-suite people. If you can build that business case and help them to understand the why and ask questions that will help them to go in that direction, it's a much easier lift, because then ultimately it's their decision. They're not being told they have to do anything, because in reality you don't have to do anything, right? But there's going to be consequences, whether if you do something or don't. There'll be positive or negative consequences. It's completely up to them.
I love that point where it's like, you technically don't have to do anything.
I throw this out once in a while. Like, people will say, and I learned this, and I've put this into practice, and I do a pretty good job with it.
Mhm.
But people will say, I would say words that I've tried to eliminate from my vocabulary are words like should, need to, have to, want, wish, all these types of words, because wishing is, or if I say I'm going to try basically, I'm telling myself I'm probably not going to do it,
Mm.
right? Or if I need to, who says I need to do anything? If your doctor tells you you need to do something, okay, but I don't really need to do it. Even if you tell me, there's a consequence, right?
Yeah.
A person doesn't need to go to work. I mean, you don't have to go to work, right? But if you
Hmm.
don't, you're not going to have an income. So I mean, you can look at all those things, and I think that's a very powerful tool from a mental health standpoint, because now
Hmm.
you're not giving away your power. You're basically saying, okay, if I don't want to do something, that's my choice, right?
Yeah.
And may not be the best, right? Whether it's individually or organizationally, but may not be the best choice, but it's my choice, and that's perfectly fine.
Hmm.
Perfectly fine as long as you're comfortable with your choice, right?
I love that type of mindset, and it reminds me of one of my favorite quotes. I'm pretty sure this is from Yoda.
Yoda,
But do or do not, there is
yes.
no try.
There's no try. I hate that kind of thing sticks in my head as well. Because once you start doing it, it's very
Hmm.
difficult to get out of that mindset. But it's somewhat freeing. I mean, because now you're not. And it's probably a little bit stronger. You're not hypocritical, right? It's
Yeah.
if I don't go out for a walk when I'd probably be beneficial if I did, that's my
Hmm.
call. But mentally, I made the choice, so I don't beat myself up about it necessarily, right? And I think
Yeah.
that's something that can transition from individuals to also companies. So it's because there's lots of stuff going on, um, and I don't, I hate for people to feel bad when they just can make the choice, right?
Yeah.
They can just make the choice. So
I love that. And I love how you pulled that together at the end too, wrap that nice little bow on it. So we're slowly coming on to the last about 5, 10 minutes of our meeting.
sure,
So 20 years in the future, right?
yeah.
What would you like for people to understand about this work that you wish you would have known when you started?
Oh, wow, that's a good question. Um, I would say start out from the standpoint of understand you're probably going to have more failures than successes,
Hmm.
right? Because you're not dealing with something simple here. You're dealing with the complexities of, um, of human thought. And when I say human thought, I mean on the individual level and then also on the corporate level, right? And
Hmm.
so you can't control how people are going to respond to information that you share. You want the best for people, um, and you want the best for the organizations that you work with, but you can't control that. There's so many things that go into it. So you're more apt to get frustrated a little bit faster. And so I would say over the years of doing this in a variety of different whether it's been this type of work or coaching or whatever it's been in this industry. Um,
Hmm.
when I was younger, um, it probably would have been smarter for me to not get frustrated, not to get as easily as frustrated. I used to get that question a lot when I was a health coach, and the question came up: do you get frustrated? because people want help. They want to get better, but it's very difficult when you don't see it happening sometimes. And and I think all you can do is the best you can, give people good information, and then let them make the decision. You can't. It's just like stress, right? You
Yeah.
can't. People will talk about stress management. I don't think you can manage stress. You can manage your response to stress, but you
Hmm.
can manage it, right? You can't the things that come upon you from a stress standpoint, you're always going to get thrown things at you, whether it's from the business perspective or the health perspective. How you deal with those is is the important thing. And I can't, like, if I'm working with you, I can't make you
Yeah.
do what I want you to do, right? And so I would say, you know, people that are coming into this industry and that play a major role in it, just understand, do the best you can, provide good information, support, and empathy, and then and let the rest take care of itself. Because ultimately, at some point, if you keep knocking on the door, it may open. But you never know when
Yeah.
that door is going to open. So, yeah, yeah, I would say that's
Yeah.
important. Keep in mind.
I love that. And I wish when I started coaching, I had that in mind too. Like, it's okay. It's a process. Slow down. It's like
It's
you
hard,
might not see it.
and it's hard because you wonder if you're doing the right things or whatnot.
Yeah.
And then when you have the opportunity to talk to other people that do what you do, and you realize
Mhm.
you're all kind of in the same boat.
Yes.
But often you don't really realize that at the time. So
Hmm.
yeah, it's a tough one. But we do what we do because we enjoy it, right? We really love it.
Yeah.
So there's a passion for it.
Honestly and truly, I don't see myself being anywhere else. And for my final question for you, if an employer takes only one idea from this conversation and acts on it Monday morning, what do you suggest it should be?
That's a good question because there's a lot of different things to go. I would I would say to recognize what they potentially could do internally.
Mm,
Right? We didn't really hit on that all that much, but I think there
yeah,
are changes that impact their employees' well-being that maybe they can do internally from the work environment space that will cost them nothing, right? And I think that's a
mm,
good place to start. We're always looking externally. What can we bring in, right? As
yeah.
opposed to looking internally at what we already have available. What can we do in our environment to improve morale, retention? All of these things play a huge impact. So that's a good place to start because bringing something in doesn't necessarily mean it's going to work. But if you listen to your people, and this is the other thing from a survey standpoint, do these periodically, right? Do
Yeah.
pulse surveys to see how things are going. I think that would be the biggest thing to start with. Like, take a look at the holistic picture, and then say, all right, maybe we can bring some things in after the fact.
I love that and kind of tying it back into the theme, especially when we're thinking about like finances and like financing the program. If you're using what's already there and what's already been baked in and just starting to kind of build from there, you're right. It can end up being something, it starts that process that builds out to that full length like kind of comprehensive wellness programs. And I think you're also right that the first thing individuals think is, oh, I have to get somebody and bring them in because we
Yeah,
don't know what's happening. When, as you mentioned, with the health insurance providers, there are so many different resources that are associated there. EAP programs have a number of different resources that are already integrated as well. So I love that call out.
yeah. Oftentimes, it's not about adding more wellness. It's not about adding more stuff. And we do that with lots of things, right? But it's
Yeah.
not about that. It's really communicating what you have, and being empathetic to the workforce, and leading in that direction. Then you can always build out. The more people you start to get involved with your planning and what you'd like to do from the well-being perspective, the easier it is to build a really solid program.
Awesome. Well, Chris, it has been such a pleasure meeting with you. You have shared so many great insights. I know for our listeners, but honestly, personally for myself as well. So, once again, thank you so much, Christopher, for taking the time to meet with me today.
I appreciate you having me. I enjoyed it.
Of course, of course. So thank you everyone for listening and be sure to come back for our next episode of Road to Wellbeing. Bye now.
Bye bye.